It's important for gay men and for men who aren't gay, and it's important for women, gay, straight, otherwise, to take care of their sexual health, because sexual health is just a part of our entirety of our beings. The same way we have shoulders and knees and hearts and stomachs, we have sexual organs, and sexual organs are I was going to say a little unique in the sense that they can bring us joy and they can bring us grief, but it's just part of the totality of our being. And to be fully human, we want to be able to embrace and use that part of our bodies and souls. APLA Health offers a number of products that are specific to the needs of gay men. For one thing, all of the medical providers at APLA Health are familiar with gay men's health and with sexual health. And so they're not going to have the hang-ups and the stigma and occasionally, unfortunately, sometimes the shame or avoidance that some medical providers bring in when sexual health is brought up. So it does make some medical providers uncomfortable, but not us, because again, we're used to it. It's part of the mission of who we are, is taking care of the gay community. In terms of other programs that we have available, we take care of a lot of people with HIV. We take care of a lot of people who don't have HIV. We take care of a lot of people who are on PrEP. And particularly when it comes to PrEP, sexual health is integrated with part of what PrEP is. So you can't do PrEP, which is all about maintaining sexual health, without addressing sexual health. And we're very well prepared to do that. So there are a number of important resources out there, and I think probably the most important resource is really knowledge. So one thing that we as gay men have dealt with now for a number of decades is this overwhelming and sometimes paralyzing fear of HIV. We have made an immense amount of progress in the treatment and prevention of HIV. So when it comes to prevention, we actually know that our most effective tool is treating people who are HIV positive. If people who are HIV positive are treated, and if they get to the goal of treatment, which is an undetectable viral load, we know now with a great deal of certainty that they will not transmit virus. So there's another name for that, a phrase that we use to describe that, and that's U equals U, or undetectable equals untransmittable. So the knowledge that we have made enormous progress in terms of preventing HIV is really important, so that we can take the fear, which can be paralyzing, and turn it into something that is knowledge rather than fear. It's also important to know that PrEP is out there for men or women who are HIV negative. And again, PrEP involves regular screening for HIV as well as for other STDs. So I really think that knowledge is power when it comes to preserving our sexual health as gay men. There are unfortunately a number of hurdles that are preventing gay men from taking care of their sexual health. And one of them is access to care. A lot of men don't realize that there is as much care out there as there is. We have it we have it here at APLA Health. At all of our sites, we have PrEP available, we have STD screening and HIV screening available, but not all people know that. When people do have access to care, it's also unfortunately the case that many providers have stigma or don't want to deal with it or don't know how to deal with sexual health. So the stigma that is out there in the community also sometimes can be a barrier to maintaining optimal sexual health. And again, at APLA Health, we don't perpetuate that stigma. This is a sex-positive zone. Sexual health is like, or sexuality is like any other part of our body or our being. It's part of our totality. And it's hard to be fully healthy, alive people if we ignore something that's central and integral to who we are. So the same way that if we ignore the health of our heart or our lungs, our overall health is going to suffer If we ignore our sexual health, our overall health and wellness may suffer. It can lead to more depression and social isolation. On the other hand, if we maintain our sexual health, it does help make our lives more complete and full of joy and fully human. So I think that we should view our sexuality the same way we view the rest of our health, not as something that we need to be ashamed of or hide, but something that we look at and acknowledge and take care of so that we can live the best lives possible.